Hi, my name's Dr. Harold Kim. I'm an allergist in Kitchener, Ontario and London, Ontario. And the following information you're going to see is actually meant for my patients that we take care of in our clinics. But if you're using the information for yourself, it should be used under the management of your physician. I'm going to demonstrate how to use the nasal sprays. So the nasal sprays we use are nasal steroid sprays, which have a steroid alone. And there's a number of different types of steroid sprays. And some of the names you may recognize would be Rhinocort or Nasonex or Flonase or Avamis. Those are sprays that just have a steroid in it. And we use those steroid sprays for patients with nasal allergies. And there's two newer sprays that have a combination of a steroid and an antihistamine in it. One is called Ryaltris and the other one is called Dymista. And those ones work a little bit better than the nasal steroids alone. But typically we recommend using these medications regularly. Most of them are used for adults or older children, 2 sprays in each nostril once a day. Some of them are recommended 2 sprays in each nostril twice a day for older children and adults. And for younger children, typically it's 1 spray in each nostril once per day. But for some of the nasal sprays, it's 1 spray in each nostril twice a day, even for children. The way that these sprays work, they're kind of typical spray medications. So you have the bottle with the nozzle on top. You take the cap off. Generally, we recommend shaking the nozzle. And I'll just show how it works. You just pump it. So you can see that spray there. Okay. So typically what we do is we recommend that you have the spray and you want to hold it so that the nozzle is pointing to the ear on the same side. Some people recommend using the opposite hand and spraying like this. So it would be this kind of direction. You don't want to spray it up because your nose actually doesn't go up. Your nose actually goes more back. So you hold it like that and then spray. You can inhale a bit if you want, but these sprays are pretty good at getting the spray into your nose. And you want to spray it again toward the ear on the same side. And then shake again, and then opposite side. And spray. If you have to, you might have to wipe the excess spray with the Kleenex. But typically it gets into the nose on the outside of your nose. And then your nose will help take the spray back and help with the allergic inflammation or swelling in your nose. And again, these sprays are meant to be used regularly. You can also use them with antihistamines, and they should be used probably if you expect to have symptoms during, say, the pollen season. Start them before the pollen season and then take them through regularly when needed. They often have more kind of peak effect after being on the medication for several days or even a few weeks. So again, they're meant to be taken regularly, and they're very effective, and they're generally very safe for patients. So we again recommend these medications often, and the technique we demonstrate is how you deliver into the nose. Thank you.